I'm Emily Bateman.
I'm Paula Nugent, and today we're going to talk about cerebral palsy. We will be discussing what it is, risk factors that contribute to a child developing cerebral palsy, whether or not it is genetic, how it affects the patients, and how it's categorized.
So you may be asking yourself, what is cerebral palsy? Cerebral palsy is an umbrella term for a group of disorders that affects a person's ability to move. This means that not everyone with cerebral palsy looks the same. There is a meaningful future for every child, adolescent, and adult living with cerebral palsy. For every person, there is a positive way forward through treatment and support provided in partnership with individuals and their families. Cerebral palsy is caused by an injury to the brain that usually happens during pregnancy, but sometimes happens shortly after birth. Cerebral palsy affects people in different ways because different parts of the brain can be injured. However, it always has some impact on the person's movements, and this is because the messages coming from the brain to the muscles are affected. Cerebral palsy is the most common physical disability in childhood, 1 in 500 children born each year. Currently, a great deal of research is being done in the field, and currently they have found that there are a number of risk factors that alone or in combination may result in injury to the brain. The most significant of these include prematurity and babies who are born with low birth weight. This often happens with twins and triplets. Other factors include the presence of blood clotting problems. This could be for either the mother or the baby, problems with the placenta during pregnancy, and some bacterial and viral infections. Contrary to what was believed for many years, lack of oxygen at birth plays a part of a very small percentage of infants with cerebral palsy. In babies who acquire cerebral palsy after 1 month of age, stroke is the most common cause. A lot of times, the question of whether or not cerebral palsy is genetic is brought up. Unlike Down syndrome, for instance, researchers have not identified a gene that directly causes cerebral palsy. Rather, they now believe that a genetic predisposition to certain risk factors may be part of the picture. In other words, a genetic condition such as blood clotting disorder to the heart or heart problems may result in an event or series of events that, when combined, can cause an increase the risk of injury to the developing brain. Cerebral palsy can be diagnosed at any time from birth, with the average age from diagnosis being 18 months. For some infants, their movement difficulties will be seen very early on. For other children, the difficulties may not be clear until they are a little older and become clear that they are progressing the same as other children the same age. Some of the signs that indicate a baby or child may have cerebral palsy include: they feel floppy when they are picked up and cannot hold their head up. Their muscles are stiff. They display unusual postures with their body. Their developmental milestones such as rolling, sitting up, walking, and talking are delayed. Cerebral palsy affects people in different ways, and this is largely due to the location of the injury in the brain. Therefore, cerebral palsy is described in a number of ways, including the parts of the body affected and the number of limbs affected. Where the whole body is affected, that is both arms and legs and trunk are affected, is quadriplegia. Where both legs are mainly affected, this is called diplegia. People with diplegia also have problems with fine movements of their hands. When one side of the body is affected, for example, the left arm and the left leg, this is called hemiplegia. The next way to describe cerebral palsy is the way it affects movement and the type of movement difficulties experienced by people with cerebral palsy. Spasticity is the most common known term. Spasticity is present in about 86% of people with cerebral palsy. They have muscles that become stiff and tight, which can make it difficult for someone with spasticity to use their muscles easily. It is difficult for someone with spasticity to turn their muscles on and off when they want to or in order to move their arm or leg to do an activity. It also increases the difficulty of them to use their mouth and face muscles to eat and talk. You might have also heard the terms dystonia and athistosis. Dystonia and athistosis describe movements seen in dyskinetic forms of cerebral palsy. Dyskinetic or dyskinesia refers to movements that are involuntary. These involuntary movements can become more noticeable when a person tries to move or when they become excited, agitated, or tired. Dystonia can present in one part of the body or throughout the body. With athistosis, we see slow, continuous, involuntary movements that are present at rest and made worse with attempts to move. One of the less common forms of cerebral palsy is ataxia. Ataxia means without order. Ataxic movements are characterized by clumsiness, imprecision, or instability. Movements are not smooth and may appear disorganized or jerky. The incoordination seen with ataxia occurs when a person attempts to perform voluntary movements such as walking or picking up objects. Ataxia causes an interruption of muscle control. Sometimes people have a mixed type of cerebral palsy. For example, some people have both spasticity and dystonia. There's a positive way forward for every individual with cerebral palsy. There are many interventions or supports that can help reduce the impact of cerebral palsy on the body and improve the individual's quality of life. Interventions are varied and severe and serve different purposes. Some interventions help to establish new skills, some modify the task demands to support the child's performance, some techniques alter the environment to increase success, while other interventions aim to prevent secondary impairments from occurring. Now, Paul is going to discuss with us the different types of interventions and how physical therapy is used for those interventions.
So, physical therapy interventions for children with cerebral palsy focus on improving the child's maximum function. These interventions help muscle strength, flexibility, the use of assistive device, and modifying tasks for ease. Most cerebral palsy patients are going to have an increased muscle tone. That's why daily stretching is very important. Cerebral palsy patients need to have daily stretching to help keep their extremities limber and allowing them to function and move around. For younger patients, positioning is also very helpful to be able to maintain a long stretch. Positioning can include abduction pillows, wheelchair inserts, bracings, and immobilizers are commonly used to help prevent unwanted tones and can also help increase vital capacity. Positioning are also known to help increase feeding success. Once a child has entered preschool stage, physical therapy will focus on maintaining their mobility and functional independence. In preschool, activities such as writing, coloring, painting, and tearing papers are very useful in helping children develop their better fine motor skills. Free play that enables the child to interact with other peers is also beneficial to help encourage socialization. These children will also benefit from activities that will help increase their stability. That's why activities such as swings and ride-on toys are recommended, because not only do they find them fun, it also helps them move around while being able to hold themselves steady. There are a lot of toys specifically designed for patients with CP. These toys are usually larger, which enables the child to have an easier grip. There are also toys that have Velcro and non-skid strips to help these toys stay in place, which lessens the risk of the child falling. In adolescent stage, gait training is introduced. It includes activities such as maintaining lower extremity strength and maintaining balance. It also includes education of proper use of assistive device and possible use of orthotics depending on the child's specific needs. Physical therapists can develop an individualized exercise program and can use adaptive sports such as swimming, biking, and basketball. These adaptive sports will not only promote physical fitness but also help develop the child's socialization skills. Also, there has been research done that shows that aquatic-based therapy is beneficial because it uses the physical properties of the water to assist or resist the performance of exercise. Hippotherapy is another option available that offers the children to have fun while gaining therapeutic effects. It can help with coordination, balance, posture, and muscular strength. Hippotherapy can give these children an opportunity to gain new sights and sensations, and children become more accustomed to typical gait, as a horse stride is similar to that of a human. During adulthood, therapy will focus on the patient being able to live independently. Strength and aerobic endurance training are emphasized. Aerobic training is beneficial as it will help the patient become more ambulatory or propelling the wheelchair. Pain management will also be a focus of therapy sessions. Cerebral palsy does not have a cure, yet us as PTs or PTAs will make a huge impact on the lives of these children that we treat. We may not cure their disease, but we help them attain their maximum potential. We are the instrument that help these children enjoy life and live life to the fullest. Let's all be proud to have chosen this field that will make a huge difference in every child living with cerebral palsy.
Thank you for that information, Paul. So now we're going to go ahead and bring Tanner Thomas, who's a doctor of physical therapy for community rehab down in Plattsmouth, Nebraska. And we're also going to welcome Ashley Bateman with us. She is a pediatric and neurological therapist at ProCare 3 in Omaha, Nebraska, and she's also specializes in aquatic therapy with cerebral palsy. So we're going to go ahead and talk to them about a few things with direct relationship on how to work with these patients who have CP. Thank you for sitting down with us today, Tanner. So can you tell us how cerebral palsy affects the pediatric patients that you work with?
Well, Emily, every pediatric cerebral palsy patient that I work with is a little bit different. Case by case variables, we're really trying to work on functionality. It kind of depends on what level they're at, how severe their cerebral palsy is, how much spasticity they have, where their tone is at, And so it really kind of just depends upon patient to patient what kind of treatment regimen we're going to take them through, and that's about it.
So, can you tell us what the ultimate goal of physical therapy would be when working with a patient with cerebral palsy?
Yeah. So overall, when I work with a patient that has cerebral palsy, I am ultimately trying to increase their functional ability with their daily activities, and really try to increase their independence so that they feel like they can do things on their own without 100% assistance. Really gearing them, trying to, so in utilizing or doing things of that nature, we're trying to look at increasing their range of motion, whether it's for reaching or standing, increase their overall core stability, their muscle function in their lower extremities, if that's really affecting them, so that they can either ambulate using no assistive device, or possibly using like some loft-strand crutches, or a kind of a stander if that's, if cerebral palsy is so bad. But really increasing their functional ability, utilizing them as being an independent person, and being able to get them independent with their activities is really what we're striving for.
How long will children with cerebral palsy need physical therapy?
That's a great question. Usually, cerebral palsy goes in stages, and so when they are all the way from infants to generally 2 to 3 to 4 years old, at that time most of the education or treatment from a physical therapy standpoint is treating or teaching parents or caregivers to do certain exercises, or work on certain stretching, or work on certain positioning things. As they progress into the school system, they become more independent with working towards, like we stress, the functional abilities, and working towards independence with daily things or ADLs. They kind of go through that as a stage of maybe 5 to 16 to 17, and then on up and through adults. I've had cerebral palsy patients that are adults that we work on decreasing their tone and decreasing their spasticity, or maybe they have a flare up in their spasticity, and so we have to work on range of motion, or work on strengthening within the core or the lower extremities if they do have a setback for any certain reason. So really, as long as they are gaining and making functional improvements, we'll continue to see those patients from the age of 0 to whenever they feel like they don't need to be functional anymore, which really, in the scheme of things, never stops. And so as long as they feel like it's appropriate and we feel like they're making functional gains, then we'll continue to see those patients all the way up through adulthood. So,
Is physical therapy a proven method when it comes to treating children with cerebral palsy?
most definitely. Really, not only from a physical therapist standpoint, but also with an evidence-based approach to things. That's kind of the realm that we're moving towards now in physical therapy, is trying to make sure that everything is backed with evidence-based research. And so a lot of the research articles say that without some sort of physical therapy, patients aren't going to get the range of motion and strengthening activities, and they're just not going to be more independent with daily activities if they're not receiving that therapy on a regular basis. And when I say regular basis, from young kids, they're having therapy sometimes daily, even twice a day in the school systems. And so as that continues then into adulthood, looking at evidence-based research articles that I've done research on, increasing that or decreasing their tone, increasing their core strength is only going to improve their functionality, and that's what we're gearing towards.
So, Ashley, what methods do you find helpful when working with a child with cerebral palsy?
One of the hardest things when working with children with cerebral palsy is managing their tone, and when you're able to help manage their tone, you're helping to make them be as functional as possible. Some techniques to help do that are NDT handling techniques, including the points of control that they teach when you use that type of handling. Also, PNF patterns can be helpful because they include rotation, which helps to break up their tone, and then also including dissociation in whatever activity you're doing can help them be a little bit more successful with what you're working on. And then also, a lot of the things that we work on depend on what their functional level is, but we work a lot on their posture control. Sometimes they need to work on their head control, and we also work a lot on them moving efficiently, especially if they're ambulatory, work on the efficiency of their gait pattern and things like that.
So how do you incorporate parents into your treatment plan?
It really depends on each family individually how willing the parents and even the siblings are to participate. I prefer as much participation as they're willing to give. During the sessions, sometimes they're helpful for helping to motivate the clients, and then also a lot of what we do is incorporate things that they can do at home. A lot of the kids benefit a lot from having a daily stretching program at home so they don't develop contractures. We also help the parents with problem solving for how it's best to position their kids at home, or if they have any equipment needs, we'll help them figure out what equipment would be the most appropriate for their situation for their family, and help their kids be as functional as possible.
Do you find aquatic therapy to be beneficial for patients with cerebral palsy?
I think aquatic therapy can definitely be beneficial for patients with cerebral palsy, especially if it's in a warm water aquatic environment. We do a lot of therapy in our pool that's between 94 and 96 degrees, which is really beneficial to help patients who have high tone and a lot of muscle tightness. We do a lot of stretching in the pool with them, and it's a great environment to have them relax as much as possible. And then we also use the water because of the buoyancy. It really helps to make the patients as independent as possible. We have some patients who are wheelchair bound on land for the most part, and they can get in the pool and they can stand. Some of them will even walk with assistance. And a lot of them really just light up and enjoy being in the water. They do a great job with it.
How do you progress a patient's goals when working with them in therapy?
Patients with cerebral palsy have a very wide range of impairments, so all their goals are specialized for each individual client. A lot of the qualifiers for the goals that I'll write for them will be the assist level, so as they improve with the task, they'll need less assistance from me. Sometimes it's beneficial to do smaller increments for your qualifiers so that they can see progress as they go along. And then also for overall progress, the GMFM is a good tool to use. It's specialized for children with cerebral palsy, so it's a standardized test and they can see their progress that way as well.
So we want to say thank you to Ashley and Tanner for taking their time and giving us the information that they gave us.
And we hope that this podcast was informational to you guys and benefits you when you're working with a patient with CP. Remember that you can be the difference in a child's life living with CP.